Hi, I'm Dr. Gregori Kurtzman, a general practitioner from Silver Spring, Maryland. Today we're going to be talking about impression materials and how to choose what materials to use for what situations. And we'll be demonstrating some of Pentron Clinical Technologies impression materials. It gets a little confusing because there are so many different viscosities, how to use the proper one for what situation. So we'll be discussing 3 different situations that are commonly used in our dental practices and how to take impressions with those. Many people are familiar with the volume mixers, and these have become very popular in the office for taking full arch or quadrant impressions. So to start off with, we're going to show how to take a full arch upper impression using the volume mixer and an injectable material. In this case, we're using Correct Plus thick and thin, which will syringe around the tooth and fill the tray up with the volume mixer, which in this case is a fast set universal material. So basically what we want to do is select the correct tray to fit the arch. And in this case, we want to make sure that the tray is encompassing all the teeth without infringing on any of the soft tissue or the teeth themselves. So basically what we would do is we would squirt some of the injectable material around the tooth, getting it into the sulcus, making sure to cover the entire tooth that we're capturing the impression for, maybe extend it a little bit beyond the preparation. We would then, using the volume mixer, fill the tray up, making sure to get enough material into the tray to encompass everything we want to capture. In the case of crown and bridge impressions, we do not need to cover the palatal tissue because that's not important for a crown and bridge impression. If we were taking a removable impression, we do want to capture that area. But we'll make sure to put a sufficient amount of material into this tray. And then we would fully seat that into the arch and allow that to set. So after letting the material set according to the manufacturer's suggested times, we will remove the impression, and we can see here how we've captured the sulcus and all the detail around that prepared tooth, and the material has actually spread across the palatal, capturing an entire arch for the impression. Our second scenario, which is very commonly seen in the dental office, is use of dual arch impressions. And these are very commonly used, and most labs will tell you that most of the impressions they're getting for single or maybe 2 units adjacent to each other are using dual arch trays. The key with a dual arch tray is we want to make sure that our dual arch tray does not contact any of the tissue or tooth so that it's not going to warp or distort when we take our impression, and that the tray extends behind and in front of our prepared teeth that we're trying to capture by at least one tooth, so that we do have enough contact area on those. So basically we're going to talk about 2 different techniques, a 1-step and a 2-step technique on how to do these. We'll start off with the 1-step technique. We use a universal body material from Pentron, which is a stiffer material when it sets, and we fill our tray with this. Making sure to get sufficient material into the tray so that we capture all the items or teeth that we want to capture. We would then, in the mouth, syringe a light body or an extra light body around the preparations to capture all those details. Making sure to capture or cover all of the areas that we want to capture with the impression and get all the detail that we want. The tray is then inserted and the patient is asked to occlude, making sure that on the opposite side of the mouth we do see occlusion that guarantees that they're not biting on the tray itself. And our final basic scenario in the dental office would be taking an implant impression. In this case, we're taking an impression of 4 implants that have been placed in the lower arch, and we're using open tray impression heads. The good thing about the clear trays is we can easily mark and visualize where those heads are going to emerge from the tray, and we have less likely we're going to remove too much of the tray and lose some of the support we're going to gain from the tray. And as we can see here, our pins are sticking out through the tray itself. What I prefer for these applications is to use a putty because it's easy to clear the pins. So what we're going to do is we're going to mix some putty together, getting a uniform mixture with no streaks. And in this case, we're using a fast-setting putty from Pentron Clinical Technologies. So we can see here we're kneading it together until we get a uniform color. We are then going to fill the tray. Removing any extra. And then we're going to take a medium body material, in this case, their quick material, and we're going to squirt this around the gingival aspect of the impression heads. This way we don't have any voids that may occur with the putty. Making sure to get this on both the buccal and the lingual. We then insert our tray fully, making sure that our pins do come out through the holes that we've created. So we would wipe that away. See how the putty is easy to wipe away. If we use a syringeable material, it's much harder to expose those pins. And we don't want to spend extra time in the mouth trying to uncover those pins after the material is set. So after the recommended setting time of the material, we would remove that. And this is the result we have. We have captured all of the arch, we have all the details, and the impression heads are basically surrounded in impression material with no voids visible. This would be then sent to the lab. They'd fabricate a soft tissue model and fabricate our prosthesis from there. So after the impression has set on the dual arch tray that we've done in a one-stage approach, we will remove that from the mouth, and we can see here we've captured all the detail of the preparation. Our impression is very stiff, so we don't get any distortion of the tray itself. The key with these procedures is proper selection of viscosities in the material to capture what we want in an accurate method. So now we're going to move on to our two-stage approach, which is also very commonly used. Again, we want to make sure our tray fits the arch, capturing what we want, not touching the tissue. And in this case, this can be either done prior to preparation of the teeth, or it can be done after. If we're doing it prior to impression of preparing the teeth, what we're going to do basically is we can use that to make our temporary and then realign it. But in this case, we're going to pretend that we're basically preparing this, taking the impression prior to preparation, even though the teeth have been prepared. In this case, we're going to place this into the mouth, and we're going to allow this to set. Again, making sure that they're occluding on the opposing arch side of the arch, so we know that they're closed properly into the tray. After the material is set, we can remove this from the arch, and we can set this aside to use for making our provisional restorations, or in this case, we're going to basically reline this immediately. We would then basically take a fast-setting extra light body material. We want to syringe that around our preparations, making sure to capture all the detail. And in this case, since we're relining this, I like to fill up the entire arch so we don't have any voids or a stepped impression. So we would squirt this material, making sure to fill in all the teeth on the side of the arch that we're capturing our impression for our prosthetics. We would then reinsert this into the mouth, making sure that the patient again closes down fully into the impression, so that we're assured that the bite in this dual arch tray is accurate for the lab to base our prosthetics on. After this is set, we would then remove this, and we have a impression with all the details that we want captured for the lab to fabricate our prosthetics on. And in closing, we want to basically, as we've emphasized, there are so many viscosities of material on the market. Selection of the right viscosity for the right situation will ensure that our prosthetics, be it inlays, onlays, crowns, bridges, will come out how we want these to come out and be accurately fitting, and also give the lab the materials that they need to fabricate our prosthetics.